Hi, I'm here with Stephanie, who's graciously agreed to be a volunteer doing tri-brain trauma therapy. Thanks, Steph.
No problem.
Tell me, what are you dealing with at this point in time? Any issue you want to work on?
A little bit of social anxiety.
Okay. Can you tell me a little bit more about that? When do you experience the social anxiety?
Anytime I need to speak or present my ideas or even talk about personal things in relationships and business, especially relationships that matter a lot to me.
Okay. Well, let's go ahead. Now, the first thing I do in tri-brain trauma theory is make sure that my polarity is established so that I'm able to test her in an appropriate manner. So what I'm going to do is put a finger over my front lip and down below, above my belly button and below, and on these 4 acupressure points, I'm going to rub for about 20 seconds. And that will establish my polarity so that I can test her without getting opposite results. Let me take an arm, Steph, and we're going to have you put the elbow nice and straight, and we're going to be above the wrist and moving this way. I want you to resist that. Breathe out, though, and don't hold the muscles in your chest or the abdomen. You're isolating here. We're not checking strength, we're checking energy. So do me a favor and hold. Good. So a strong indicator muscle is showing fine, so we can use this muscle. Now what I'm going to do is check the polarity point to make sure that your brain is running the right way so that we can get good results. So I'm going to put a finger right above the brow, or the nose, bridge of the nose. Breathe out. And when it weakens, it tells me that her polarity is correct, which means that the right side of the brain is taking care of the left side of the body. You can go ahead and put that arm down and rest it. And the left side of the brain is sending messages to the right side of the body, and that means the prefrontal cortex is on, and that's what we want to be able to establish good polarity and be able to have reliable results with muscle testing. So consciously, what you're telling me is that you've got some social anxiety. I'm sure you're right, but I don't know if the subconscious mind or your body is impacted enough by that to be upset with it. Let's check it though.
All right.
Do me a favor and think about that social anxiety. Breathe out. And it seems to agree with you. So what we're going to do is we're going to go to the alarm points on the meridian to check and see what point is going to make that weak arm strong. So what I want you to do is to touch here. Breathe out. And if it's weak, it's not the active point. Touch here. And that is not active as well. I'm going to take a shortcut and go to the kidney meridian to check. Breathe out. And that is the active point. Go ahead and put that down. The reason that I went to the kidney meridian is that the emotions in the kidney meridian fit some of the things that Stephanie is talking about, but we need to check out and see if indeed the emotions are there. So what I want you to do is think of fear. Breathe out. And that seems to be accurate. Fear of what, Stephanie?
Fear of being attacked.
Physically?
Verbally, physically, being criticized. Yeah.
Think about that. And that fits. That does seem to be what's happening. Concept that it's your fear. Think about that. And that seems to be accurate. Put that down for a second. Usually it's the person's fear, but sometimes they're sensitive to somebody else's fear. This one seems to be yours.
Okay.
So we've got the emotion, we've got the meridian. What I need to know is the concept that there is an earlier event where you've had this kind of fear. So let's check that out. And let me check here. Breathe out. And you switched off. So do me a favor and establish polarity. anytime you get results that don't quite make sense consciously, at least check to see if the polarity is on. Very loud. Good, and it's back on. So, concept that there was an original event where you were afraid for saying how you felt. And that seems to be accurate. Concept that that original event happened between the ages of conception to 10, wonder about that. 10 to 20, 10 to 15, 10, 11 years old. Can you think of anything that happened at 11?
Yes, I had some significant things happening at that time. I believe that my girlfriends told me I was a heathen and I was going to burn in hell for not having religious beliefs.
Had you talked to them about your lack of religious beliefs?
Yeah, I think we talked about a lot of different things, and I just had never really been raised with anything, so they were very religious and I wasn't. And it was fairly constant onslaught. They wanted me to go places with them and things, and I was like, I think I would feel more comfortable if you gave me a book to read.
So you opened up and they attacked.
Yes.
Let me check that. And that seems to be accurate. Now what I'm going to do is check that to the kidney meridian again. It is still active, which means that the correction might well have to do with that point. You always want to check and make sure it hasn't moved, although usually it doesn't. Go ahead and put that down and relax for a moment. Now what I want to do is I also want to check to the chakra system and see if any of those points are active. So I want you to think about the episode at 11 again. And the crown is not active. And the brow is active. So we've got an active brow chakra, which is about intuition and going with your feelings, which evidently was dangerous in this instance. And we had the kidney, which was anxiety. So the concept that where we need to make the correction is in the meridian system. Wonder about that? And it seems yes. Concept that we also need to make a correction in the chakra system. And it seems like we need to do both. Now at times it will, the body will simply say meridian, other times it will say chakra, and sometimes both. What we're going to do is the meridian first, but before we do that, we want to do a global prophylactic maneuver to make sure that there is no problem with psychological reversals. So what I'm going to ask you to do is to touch right here on the sore spots of the chest.
Okay.
Yep. It's a lymph node, but it has to do with psychological reversals. Sometimes we sabotage ourselves and want to get out of something and don't want to get out of something at the same time. So what I want you to do is to roll that in a circle clockwise. So you go that way, yeah. And I want you to say, I deeply and profoundly
I deeply and profoundly
love and accept myself,
love and accept myself,
even though I believe that if I say my truth, it's going to be dangerous.
even if I believe if I say my truth, it's going to be dangerous.
And if you could say that 2 more times.
I deeply and profoundly love and accept myself, even if I believe if I speak my truth, it will be dangerous. I deeply and profoundly love and accept myself, even if I believe that if I speak my truth, it will be dangerous.
Okay. Now, what I'm going to ask you to do is to touch the, localize the kidney point, go right over the emotional points, and I want you to turn. Right in here will be the correction. You could specifically go T2, 5, and 8, but we're going to take the full range because we're not chiropractors here. We're going to just make sure that we hit every one. If you put a V right there and have you think about that issue at 11, And I'm going to tap while she breathes easily. Go ahead. Breathe all the way in and hold, and all the way out. Excellent. And turn for me. Think about that issue again. We've got a strong arm. I want to make sure the kidney is strong. Hold real tight for me. Good. There's a feeling when somebody's not holding as tight as they could, and that can knock you off of good muscle testing. Check it again. Okay. Excellent. But we still have the correction on the chakra to make. So what I'm going to ask you to do is put a few fingers right here on the brow, and then your hand over the emotional points here. You can just close your eyes. I want you to think back of what those girls did. And breathe easily and deeply. Take as much time as you need. And whenever you feel a sense of relief, then you go ahead and drop that. Letting you know. Check. Look at that issue at 11. It's nice and strong, indicating that the toxicity has gone out. If you could turn your head to the left, all the way to the left, and I'm going to look to the right. Any other emotions about this issue? Now, if that had weakened, we would need to go through the process all again to see which chakra or which meridian was still up. Look right eye into my right eye. Any other emotion about that issue? And that's strong. If that was down, again, we'd have to find the chakra system or the chakra or the meridian and find out which was active. Go ahead and put that down for a second. And think of the present feeling of social anxiety. Breathe out. And how do you feel?
I feel very good.
Very, very good.
Very
Thanks,
excited.
Steph.
Thank you.